as a GP, what is the one thing we want most for our patients? For me, it has always been to offer high quality of care to all of my patients and to make sure that no one is excluded or left behind and the voice of the patient is heard.
I think they do quite well, the doctors that I'm under now, but not every doctor I would give flying colours to that I've seen. I think all doctors, sometimes rush.
I just like seeing the same doctor, but sometimes I can't, so I have to see someone else.
I'm quite independent, I go on my own, but my husband, on the other hand, has got very high needs. He had to change surgeries because it wasn't disabled access.
But did you know that people with learning disabilities have a significantly lower life expectancy than people in the general population? Shockingly, this is 22 years less in the case of men and 29 years for women. And people with a profound or multiple learning disabilities have a mean age at death of 41 years. And this is not solely due to complex comorbidities, but frequently relates to preventable and treatable conditions. These figures certainly made me stop in my tracks and wonder what we as GPs are doing to improve these statistics. So when I was appointed the role of London Clinical Champion for the Learning Disability Review Programme, or colloquially known as the LEADER Programme, this was something I felt I could make a positive contribution towards. So what is the LEADER Programme? It is a national initiative which has been commissioned by NHS England to support local areas in England to review the deaths of all people with a learning disability who were aged 4 years and older at the time of their death. After a death, a reviewer is appointed, and they work to identify learning points so that action plans can be developed locally to improve care. It's important for you to understand this is a review to support quality improvement. It is not an investigation. So where do us as GPs need to contribute and participate? Firstly, we need to notify the death of any of our patients with a learning disability to the LEADER programme. You can do this by speaking directly to a member of the LEADER team or by using the secure web-based portal on the LEADER website. And secondly, we need to engage with the LEADER reviewers and help them understand the circumstances leading up to the death of the deceased person. So what else as GPs can we do? We should encourage our patients to attend for their annual flu jabs. We should encourage them to engage with cancer screening programs. But of course, probably the most useful thing we can do is to ensure that it's easy for them to attend their annual health checks. The annual health check is an opportunity to take a holistic view of our patients, bring all the information together, and develop a health action plan to try and ensure the patient receives proactive, good preventative care. I recommend the excellent resource developed by the Royal College of General Practitioners, where there's a step-by-step guide on how to approach this health check. This is a short video, but in conclusion, there's much that we GPs and our practices can do to improve the standard of care for our patients with learning disabilities and ultimately reduce the health inequalities experienced. This work is important, and we should not underestimate the positive contribution we can make to our patients, their families, and carers.